Miranda Mollenhauer. From 1978 to 2014, the United States prison population rose 408%. This fact is according to the American Civil Liberties Union, a nonprofit organization that works to defend and protect the Constitution of the United States, in the article The Prison Crisis, written January of 2016. We all remember the time when the convicted drug offenders from the prison came and talked to us about their experiences with drugs for health class. The United States Department of Health and Human Services should fund a treatment program instead of incarceration for nonviolent drug offenders. First, I will tell you about the problem of too many drug offenders in prison. Then I will tell you how sending nonviolent drug offenders to community-based research programs is a great solution to this problem. To begin, there is a problem of too many drug offenders in prison. America has the highest prison population of any country in the world. America makes up 5% of the world's population and 25% of the world's prison population. According to Sam Taxi, Julie Samuels, and William Adams, all research associates at the Urban Institute, in the article Drug Offenders in Federal Prison, Estimates of Characteristics Based on Linked Data, written October of 2015, half of the United States federal prison population is made up of drug offenders. This problem has become significant because of war on drug policies that started with President Nixon in 1971 and have grown harsher throughout the years. This problem is significant to millions of Americans. According to the U.S. Department of Health and Human Services, a department of the United States government, in the article Facing Addiction in America, written in November of 2016, substance use disorder is considered a medical illness characterized by significant impairments in health, social function, and voluntary control over substance use. People with moderate substance use disorders can receive general treatment, but those with severe substance use disorders may require specialty treatment that will not be offered to them in prison. This problem is much more significant to African Americans because they are convicted for drug crimes more than whites and are often put in prison longer than whites. According to the NAACP, the nation's oldest, largest, and most widely recognized civil rights organization, in the article Incarceration Trends in America, written in March of 2009, 5 times as many whites are using drugs as African Americans, yet African Americans are being convicted for drug offenses at 10 times the rate of whites. African Americans serve almost as much time for drug offenses as whites do for violent offenses. Sending nonviolent drug offenders to prison is also very harmful to the United States economy. Not only is it expensive to prosecute them, it is expensive to detain or imprison them. According to Alex Sheshkovich, the Humanities Public Information Officer at Stanford University, in the article The United States War on Drugs, written in April of 2010, the United States spends $50 billion a year just on trying to get rid of drugs in this country. This doesn't include another $10 billion a year that we spend on putting drug offenders in prison. This problem has become so severe that the United States is now spending more money on building prisons than it is on building schools. Now that I've told you the problem of too many drug offenders in prison, I will tell you the solution to fixing this problem. Funding a treatment program instead of incarceration is a great way to reduce the United States prison population. Drug addicts should receive treatment in community-based treatment centers instead of going to prison. Research shows that treatment can help many drug offenders change their attitudes, beliefs, and behaviors. It can also help them avoid relapse and successfully remove themselves from a life of substance and crime. Treatment improves individuals' quality of life, health, and productivity. Prevention and treatment plans should be implemented in society. The Substance Use Care Continuum is the recommended care plan. It has 5 different programs in it: enhancing health, primary prevention, early intervention, treatment, and recovery support. Many prisoners do not have access to regular healthcare services outside of prison. This means that they are unable to get themselves the help that they need outside of being convicted. Significant research values the merging of prevention and treatment plans into criminal justice settings. Patients require long-term or repeated care in order to achieve the long-term goal of recovery in their lives. This solution has proven to work in other cases. Since 2012 in Seattle, the police department has enacted a law enforcement assisted diversion program, also known as LEAD. Instead of sending nonviolent drug addicts to prison, the officers directly connect them with treatment and services that will help get them clean. Services and treatments that addicts receive include housing, healthcare, job training, and treatment and mental health support. According to Susan Collins, Seema Klifasefi, and Heather Lonzak, all of whom have their PhDs, in the article Innovative Law Enforcement Assisted Diversion Program is Showing Success, written April 8th of 2015, addicts in lead were 58% less likely to be arrested than those in the control group. Costs of prosecuting nonviolent drug offenders have gone down because they are prosecuting and imprisoning less offenders. This solution will work because we'll be putting less people in prison, therefore reducing the prison population. We know this solution will work because lead has been associated with significantly fewer arrests and felony charges, as well as less legal and criminal justice system usage. Implementing treatment plans in society can save the United States a lot of money. Studies show that for every $1 spent on substance use disorder treatment saves us $4 in healthcare and $7 in criminal justice system costs. Sending nonviolent drug offenders to prison can save the United States billions of dollars per year. According to Nora Volkow, director of the National Institute on Drug Abuse, in the article Principles of Drug Addiction, a research-based guide, written in December of 2012, if we sent just 10% of nonviolent drug offenders to community-based treatment programs instead of prison, we would save $4.8 billion compared to current practices. In conclusion, the United States prison population is way too high, and this is partially due to the prosecution of drug offenders. In order for the United States prison population to go down, we must send nonviolent drug offenders to community-based treatment programs. Sending nonviolent drug offenders to community-based treatment programs will create a better society and nation as a whole.
6:20.